David, hard-hitting and emotional stuff on the film. What do you think the lessons are for the Department of Health, and how might the Department of Health in the UK respond?
Well, I think the film will help us to react with more urgency. The film, because it has such a personal angle, as well as the science, has a powerful impact on anybody, even in maybe distant bureaucracies like the Department of Health. We're already doing work already. We subscribe to the government's climate change policy, and we have our own approach to that, but we need to do more. We have a leadership role for the whole department, for the whole National Health Service, and which 1.3 million people work, and we churn out 18 million tonnes of carbon dioxide a year, a huge amount. So our leadership role is key. We are doing several things. One is the purchase of care out there, organisations called primary care trusts. We are going to make certain their commissioning of the care makes certain that it takes into account all the climate change issues, and therefore there's better governance. All organisations have to look at low carbon output. How we reshape care is an important bit, because we don't pay enough. We put more money into prevention than any other equivalent healthcare system, and it's a tiny 4%. And we're committed ourselves, we hope, over the next few years to increase that, because if you get better prevention, you can look after patients who suffer disproportionately from some of the consequences of lifestyle, like people who are from poor areas. Then we can not only lessen the needs for healthcare and therefore save carbon, but give them a better quality of life and be part of a sustainable future. So we've got a clear drive to make certain that happens in the health service as well.
And what would you say to people who would argue that politicians aren't doing enough, they're waiting for the voters to give them the kind of permission to act, that sort of standoff, if you like, between the politicians who seem to want to do the right thing but don't necessarily have permission to do it? What's your view on that?
Well, this is a personal view, of course, but I think there is an element of that. All the politicians I work with at the Department of Health are very committed to this. But I suppose when you get near an election, there's always tensions. But I think we have strong leadership. Our Secretary of State is committed to this as a future way of changing the healthcare system. So I think at the moment, and films like Franny's helps enormously, to get people energised above some of those worries about what's the vote going to do.
Because if we're talking about 80% reduction by 2050, is that what
Yes.
we're saying we've got to achieve? We're talking not just about tweaks, we're talking about a completely different structure to our Western civilization. And healthcare, you know, a huge contributor to climate change, a huge kind of product of climate change. What would you say to that, the need to completely restructure?
Well, hugely. That's why I think we need to put more money into looking at how we can prevent people from getting premature problems in terms of illness, how we can get more care delivered nearer their homes, the reliance on some of the technology, which is useful in some places, but in many cases is found to be now not as useful as we think. That ties up a lot of our carbon. Some of the prescribing of drugs, which could have other alternatives, such as better lifestyle and so on, can lessen the amount of money we spend on pharmaceutical products, which are a huge carbon production. As also shifting care out of many of the hospitals. A lot of care that's done in hospital now doesn't need to be done there anymore. Okay. That's a huge culture change, but unless we do it, as Hugh has said already, you know, the health service will contribute to this disaster rather than helping it.
Angela, how can we make the NHS more resilient to climate change?
For me, the real power of this film is that it puts together the energy crunch, the credit crunch and the climate crunch. And it's no accident that we've recently seen the near collapse of money. And for the health service, we have to know how the health service is going to function with less energy, less carbon, less money. It's not optional. We're going to have to make that transition one way or another. So we have to start planning it now. So number one, I would urge every single NHS organisation to organise a showing of this film in as creative a way as you can possibly think of. You know, have lovely tickets for it, involve everybody, sandwich it between a short presentation about what you've managed to do already, and then follow it by an external speaker to give you a bit of encouragement and real workshops on what you're going to do. And every single individual, family, NHS team and NHS institution needs to be thinking now, right now, how will our service hang together? Where are its oil and fuel shortage vulnerabilities? How will it manage in heat waves and floods? How will it manage with less money? And how will it manage if it can only emit 30% of the carbon, say? And we all know that there are best value bits of the health service that we would hang on to at all costs. And there are lower value bits that we will just have to, you know, get over it. We're going to have to ditch those. And
And that's
we're
a
all in
debate
this
you
together.
think we should, that's a debate you think we should be having now?
No, I ran a World Cafe yesterday evening in Bristol with health leaders and experts in all kinds of fields on exactly this. The scenario was, you know, oil prices are trebled, money is down to 900 quid a head, carbon emissions have got to be 20%, and you've got 10,000 climate refugees. Imagine if we managed to actually get to that, what would it look like? And then backcast, well, how do you get there? And people were incredibly engaged. But at the moment in the NHS, you know, you're not allowed to do that. I mean, one thing we always come up against is whose job is it to tell the public how bad it is? The government is doing nothing to tell the public. Franny's doing a lot.